Yes.
Come on in.
Hi.
Hi, how are you today?
I'm okay. How about you?
I'm well, thank you. My name is Jen, and I'm going to be your nurse practitioner today. I'm going to do your examination, but first we're going to go over your health history.
Okay.
Can you start by telling me your full name?
Frank James Dimmick Jr.
And verifying your date of birth, please.
1288.
All right. Mr. Dimmick, is that what you'd like me to call you?
You can call me Frank.
Okay, Frank. Can you verify, is this your name, your date of birth, your address, and your contact information?
Yeah, it's all right.
Okay, thank you very much. All right. So what brings you here today?
I have abdominal pain.
Tell me more about your abdominal pain.
It just hurts when I eat like late at night, and then when I get up in the morning, I'm sick.
What do you mean by sick?
Throwing up.
Okay. Is there anything that aggravates it?
Peanut butter especially.
All the time?
Every time.
Okay. Is it right after you eat the peanut butter or?
No, like I said, in the morning.
Okay, in the mornings. Now, how long has this been going on?
Couple years.
Okay. Now, do you have pain in your abdomen? Can you tell me exactly where?
It's not really, I guess, a pain per se. It's just irritation from vomiting.
A discomfort? Is that how you?
Yeah.
How would you describe it? Achy, sharp?
Achy. Yeah.
Okay. How long have these symptoms been going on?
A couple years.
Okay. Do you know what started the symptoms?
No.
No. Okay. Have you taken any medications in the past for this?
Yeah, I took a generic Prilosec or no, it wasn't Prilosec. I don't remember what it was called.
Okay. So did you see a specialist for this?
No.
Okay. Is there any activities that it stops you from doing, such as eating, sleeping?
No, not really.
No. On a scale of 1 to 10, how would you rate the pain, with 10 being the worst?
Like I said, it's not really a pain. It's just an ache. It's an irritation.
On a scale of 1 to 10, how irritating?
1.
Okay. All right, let's talk about your past medical history now. How would you rate your overall health? Good, fair, poor?
Good.
Okay. Have you experienced any major childhood illnesses in the past?
No.
No. Have you ever been diagnosed with any chronic conditions, any heart problems, any hypertension, high blood pressure?
No.
Nothing like that? Okay. Are your immunizations up to date?
Yes.
Have you had any surgeries in the past?
No.
No. No wisdom teeth removal?
Nothing.
Nothing. Okay. Have you experienced any serious injuries in the past? Any broken bones, anything like that that limited your functional ability now?
No.
No. Okay. Are you currently taking any medications?
No.
No. Now, the Prilosec or whatever you thought you had been on in the past, did you take yourself off of that, or was that taken from you?
I took myself off of that.
Because your symptoms got better?
Yes.
Okay. Do you take any other supplements, any herbals, vitamins, anything else over the counter that is not prescribed to you?
I take a daily vitamin and a beard pill.
So a hair growth?
Yes.
Okay. Alrighty. Do you have any allergies?
No.
To medications, food, any seasonal allergies?
Mm.
Have you ever had a blood transfusion in the past?
No.
Okay. Have you had any recent screening tests? Have you seen like a ophthalmologist for your eyes, been to the dentist?
No.
Do you know when the last time any of those exams were?
Over a decade.
Okay. When was your last physical exam?
Two years ago.
Okay. Has anything changed since that exam?
Nope.
Okay. How would you rate your emotional well-being? Good, fair, or poor?
Fair.
Okay. All right, let's talk about your family now. Are your parents still living?
Yes.
Okay. How old are they?
Well, 60 something. Early
Both.
60s.
Both of them?
Yeah.
Okay. Have they been diagnosed with any major health concerns? Any hypertension, high blood pressure, heart disease, any diabetes?
My dad has a heart condition. His AFib, I think that's what it's called.
Okay. Do you know when that was diagnosed?
No, I do not.
How about your mother?
She has asthma.
Okay. Do you know when that was diagnosed?
Before I was born.
Okay. All right. Do you have any siblings?
Yes.
How many?
I have 2 sisters and a brother.
Are they healthy?
Don't
They have any major health concerns?
know of any major health concerns.
Okay. Do you have a history of any genetic disorders in your family?
Diabetes.
Who in your family had diabetes?
Everyone on my mom's side. I mean,
Okay.
everyone's broad, but everyone, a lot of people.
Anything else?
Cancer. It's very prevalent on my dad's side.
Any certain type of cancer?
Leukemia.
So blood cancers? Okay. Are your grandparents still living?
No.
Do you know what caused their death?
Cancer and a heart attack.
Okay, let's start with your maternal grandparents. Your maternal grandfather? Do you know what he passed from? Okay. How about your maternal grandmother?
A heart attack.
Do you know how old she was?
91. Taking a stab at it.
Okay. How about your paternal grandfather?
He died from leukemia.
Okay.
And I was in 2nd grade, so I don't know.
70s, 80s?
I was
70s?
born in 88, man. Talk.
No, was he in his 70s or 80s?
I don't know.
Okay. How
I
about
was
your
in 2nd grade.
How about your paternal grandmother?
She died of cancer as well. I don't know what kind of cancer it was.
Okay. All right, thank you. So let's briefly review your social history. Do you practice any type of religion?
No.
No. Okay. Do you have any cultural health care restrictions or anything like that?
No.
Alrighty. Are you married or single?
But married.
Married. Do you have any children?
2 boys.
What are their ages?
6 and 8.
Okay. What's your living situation? Who do you live with?
My wife and my family in my home.
So your wife and your 2 children?
Yes.
Okay. Do you feel safe there?
Yes.
Do you have any particular stressors in your life? Financial, marital, your employment?
No.
Anything like that? Okay. What's your highest level of education?
College courses.
Okay, so some college. Okay. What do you do for a living?
I'm a commercial roofer.
Where do you work?
In the Pittsburgh area.
Do you like it?
I love it.
Alrighty. Do you have any history of smoking?
No.
Okay. How about drinking alcohol?
Yes.
Okay. Tell me about your history. Occasionally?
Every day.
Okay. How much do you drink a day?
3-4 glasses of wine.
Okay. Any illicit drug use?
Marijuana.
Okay. Now, do you inhale this or do you take oils?
Most of the time I just inhale it.
Okay, inhaled. How often?
Every day.
Okay. Is there a certain thing that you use this for? A certain symptom?
Anger.
Okay.
And it helps my stomach.
Alrighty. Do you have any at-risk sexual behaviors? Multiple
sorry?
sexual partners?
What was the first part of it?
Do you have any at-risk sexual behaviors?
At risk?
Yes, multiple partners.
No.
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 Unprotected sex?
With my wife? Yes.
Okay. Do you have any issues accessing care?
That's what I was trying to tell you. Accessing care?
Accessing health care?
No.
Okay. All right, so let's review some of your head to toe symptoms that you could be experiencing. Do you have any pain anywhere right now?
No.
No. Do you experience any fevers, chills?
No.
Any night sweats?
No.
What's your normal sleeping pattern? How many hours of sleep do you get a night?
At least 5.
Okay. Do you feel like that's enough or you could use more?
No, I could use more.
Are you satisfied with your weight, your current weight?
Mm-hmm.
Okay. Have you previously been diagnosed with any skin, hair, or nail, any issues like that? Any?
No.
No. Okay. Do you have any rashes anywhere, itching?
I have, like, psoriasis, I think, is on my knee.
But it was never diagnosed, the psoriasis?
No, not medically.
Okay. Do you have any increased pigmentation
On
of
my
your
knee?
skin? Anywhere.
On my knee?
Okay. Which knee?
My right knee.
Okay. Do you have any excessive sweating or hair growth anywhere?
No.
No. Okay. Any headache, dizziness?
No.
Any lightheadedness or trauma to your head in the past?
No.
Or any previous concussions?
No.
Okay. Any issues with your eyes? Do you wear glasses?
No.
Okay. Do you have any discharge from your eyes?
No.
Have you ever been to the ophthalmologist and been diagnosed with glaucoma or cataracts?
No.
Do you have any other type of eye condition? Any redness? Any watering, itchiness,
No.
dryness? No. Okay. Do you have any issues with your ears? Any problems hearing?
Yes.
All the time?
Yes.
Is it muffled?
It's not there.
Okay, so just decreased. Okay. Any ringing or buzzing in your ears?
No.
Any vertigo?
No.
Okay. Any problems with smelling?
I don't think.
Any
that
changes?
No. No.
Okay.
No.
Any polyps in your nose?
No.
Okay. Do you have any runny nose, increased mucus or anything?
Only because of this mask.
Okay. Problems with your mouth, your teeth. When's the last time you went to the dentist?
Over a decade ago. Yeah.
Okay. Do you ever get mouth sores?
No.
Do you have any difficulty swallowing, pain on swallowing?
No.
No. Any changes in your taste?
No.
Okay. Do you have any swelling in your arms or your legs?
No.
Have you noticed any lumps or bumps anywhere, specifically your neck, your underarms, your groin area?
No.
Any tenderness anywhere there?
No.
Okay. Any cough, shortness of breath?
No.
No. Do you have any pain on inspiration? So when you take a deep breath, do you have any problems taking a deep breath?
No.
Okay. Have you ever had a chest x-ray?
Yes.
Do you know when that was?
No.
Okay. Have you noticed any enlargement or tenderness to your breasts?
No.
Do you experience any chest pain, palpitations, or fluttering in your chest?
No.
No. Do you have a history of high blood pressure?
No.
No. Have you previously had a heart attack?
No.
Have you ever had an EKG or an echocardiogram?
No.
No. Okay. Have you been diagnosed with a blood clot in the past?
No.
Do you have any discoloration to your legs?
No.
No. Okay. Have you ever been diagnosed with anemia?
No.
Have you, do you bruise easily?
No.
Do you have any, if you cut yourself, do you have any problems stopping your bleeding?
No.
Okay. Tell me about your appetite. Good, fair, or poor?
Good.
Okay. Do you ever experience heartburn, indigestion, nausea and vomiting, aside from what we spoke about earlier?
No.
No. Do you ever have any blood in your vomit?
No.
Okay. Do you experience diarrhea or constipation?
No.
Ever had any yellowing of your skin or the whites of your eyes?
No.
Have you previously been diagnosed with gallstones,
No.
tumors, or any polyps?
No.
Okay. Do you have any reoccurring symptoms besides the abdominal pain?
No.
Okay. Any change or in color or consistency of your bowel movements?
No.
Have you previously had any diagnostic imaging, endoscopies, colonoscopies, CT scans of your abdomen?
Yes.
Okay. Do you know which test you've had and when?
I had an endoscopy probably 3 years ago.
Okay.
2 years, I don't know.
Do you know what it showed?
Just
No.
mild tenderness, mild redness.
In your stomach? So
Yeah,
like
the
a...
lining of the stomach
Okay.
was mildly irritated, I believe is how they put it.
Okay. Alrighty. What's
No
your diet?
ulcers.
I'm sorry?
No ulcers or anything
Oh,
like
good.
that.
Okay. What is your diet like?
Good.
Good. Okay. Do you have any restrictions? Are you in your diet vegetarian, vegan?
No.
Okay. Do you take any supplements?
Just the ones I told you about.
Nothing for weight?
No.
Okay. How often do you drink caffeine?
Rarely, honestly.
Okay. Have you ever been diagnosed with diabetes or a thyroid disease?
No.
No. Okay. Do you have any changes in your weight recently?
No.
Any increase in your thirst or increase in urinary output?
What was the first one?
Increase in thirst?
No.
Okay. Do you notice any enlargement in your thyroid? Anything in your neck feel tight?
No.
Okay. Any heat or cold intolerance?
No.
Okay. Any changes in facial and body hair?
Yes, but I'm taking
From
it
your
through the
previous supplement? Okay. All right, now I'm going to ask you about your sexual history. So do you have any sexual dysfunction? Any inability to get or maintain an erection or an ejaculation?
No.
No, okay. Do you have a history of any sexually transmitted diseases?
No.
No, okay.
It's deep for the first date, dog.
Any changes in the way you walk? No. Do you experience any joint stiffness, any pain in your joints, any redness, tenderness,
No.
swelling? Nothing like that. Okay. And you don't require the use of any assistive devices, any walkers, canes?
No.
Okay. Do you have any histories of seizures, tremors, numbness, tingling fingers and toes? Any memory loss, weakness, and paralysis?
No.
Do you have any previous history of depression or anxiety?
Yes.
Okay, which one?
Anxiety.
Okay. Were you on anything for that?
Zofran? That's for nausea.
Zoloft?
Maybe.
Okay. Did you take yourself off with that, or was it taken from you?
Sertraline, I think is what it was called.
Yep, that's Zoloft. Thank you.
No, I took myself off.
Okay, were your symptoms better?
Yeah.
All right. Do you feel like they're staying better?
Yes.
Good. Do you have any thoughts of harming yourself or others?
No.
Do you have any new sleep disturbances?
No.
Okay. All right, Frank, I'm going to give you this gown. I'm going to step out, give you this gown. You can change into it. You can leave your underwear on, and the strings go in the back. Okay, and I will return. Thank you.